quite happy with it. For the feedback, please welcome Mr. Greg Shaw.
Good afternoon. Thank you to my committee members. As much as I was the designated expert for my group, I think I learned as much from my group as what I provided to my group. So thank you for the work and the summary of the work that you've done. I also want to acknowledge the G20Y and thank them for welcoming me to this very interesting and delightful event. The number of people today over the age of 60 has doubled since 1980. It's not very long ago. The number of people over the age of 80 will almost quadruple to 395 million between now and 2050. With statistics like this, it's not surprising that ageing is often stated as one of the greatest challenges or problems that we face in the coming decades. But the challenge we are facing is not population ageing. It's the outdated and ineffective policies and practices that are in place today. There remain significant obstacles raising the productivity and labour force participation of older workers. Our workforce is poorly prepared to understand how ageing, future finances, working options may impact future working opportunities, priorities and choice. The longevity revolution has profound implications for pension systems globally. Our traditional approach to entering retirement phase and an arbitrary retirement age of 65 is outdated and contrary to the increasing trends of individualisation and longevity that exists today. I was really pleased that our working group wanted to redefine the definition of working age. For those of you who don't know, the current definition of working age that's used today, being 15 to 64, was first introduced in the first 10 years of 1900. Yet we still use that definition today. It is really a ridiculous definition when you consider the people that are entering workforces today. So the recommendation to look at a 20 to 74 or 21 to 75, I certainly would support. Japan was represented in our group significantly in a lot of discussions. It's the oldest country in the world today in terms of its population. 32,000 people in Japan will turn 100 this year. But longevity is going to impact us all between now and 2050 significantly. While Italy is one of the oldest countries in Europe today, 34% of the entire population of Europe will be over the age of 65 in less than 14 years. So it's not a very long time. In terms of healthcare, I want to touch on an issue around health and wellness, and it's really one that's dear to my heart, and it's the issue of adult vaccinations and actually how you improve health and well-being and improve productivity and ability for people to remain in the workforce. Take, for example, the annual influenza vaccine. In Europe today, there's a 44% uptake rate, which prevents 21 million cases of the disease and approximately 65,000 admissions to hospital. But more importantly, it prevents 37,000 deaths a year. If we reached in Europe a target of 75%, we would prevent 3.8 million cases, 97,000 admissions to hospitals, and approximately 51,000 deaths every year. Pneumonia is also preventable. Now, people would have remembered probably 2 weeks ago there was criticism about Hillary Clinton contracting pneumonia and her inability to remain campaigning on the campaign. It's preventable. There's a vaccine for it. Yet the knowledge and awareness about the availability of that particular vaccine is not known. Yes.
That wasn't mine.
For people with pneumonia, for people who contract pneumonia, there's a fourfold increase. They're also going to have some cardiovascular disease implications in the first 30 days of pneumonia. There is a 1.5-fold chance that that instance might happen within a year after contracting the disease. The average length of stay in hospital across Latin America for someone with pneumonia is 14 days. Imagine the healthcare costs that could be saved through improved vaccination rates amongst older people. Pneumonia costs health systems in Europe approximately €5 billion per year, a cost that is largely preventable through improved uptakes of adult vaccination rates. Who here today are over the age of 50? Me, over the age of 50. Nobody. I'm the oldest. So there's some messages that you can take home to your mother and father. Make sure that they have their annual influenza vaccine. Check whether you've had your tetanus, diphtheria, or pertussis, which is whooping cough. Shingles. Anyone over the age of 50 should be looking at a shingles vaccine. And a once-off vaccine of pneumococcus for pneumococcal, you should be talking to your GP about it. There are 4 vaccines which will enable people to remain healthier and in the workplace for much longer in later life. There remain some significant obstacles in raising the productivity and labour force participation of older workers. Ageism is probably the most socially tolerated form of discrimination in society today. And to say it doesn't exist, I would say it exists everywhere. There are implicit biases against older workers in the workforce, which needs to be dealt with by both government and by the corporate sector. Population ageing is emerging as one of the most critical issues in the healthcare system across the globe. Rethinking how we can provide to older people must be a priority with greater emphasis on health and well-being. And that's where the corporate sector can play a role in providing health and wellness programs to their older generations. Now, I want just 1 minute of your time, because I want to talk a little bit about people that raise the issue of immigration, migrants, and diversity. And I want to just talk a little bit about our Canadian Prime Minister. Justin Trudeau, last week, spoke about Canada's diversity. In Canada, we got a very important thing right. Not perfect, but right. In Canada, we see our diversity as a source of strength, not as weakness. Our country is strong, not in spite of our differences, but because of them. He talked about the mistakes that Canada's made and emphasised them. But he talked about in recent months, Canadians have opened their hearts, their arms, to families fleeing ongoing conflicts in Syria. And from the moment those 31,000 refugees arrived in Canada, they were welcomed not as refugees or burdens, but as neighbours, friends and family members. But more importantly, welcomed as Canadians. I say to you, open your hearts and communities and workplaces to the opportunities that older people can bring to benefit you, your workplace, your family and your life. So thank you.